Welcome to the Deep Dive, where we really try to peel back the layers and uncover the unexpected.
That's the goal.
And today, we're plunging into a world where appearances are, well, profoundly deceiving.
Yeah.
Literally.
Yes, exactly.
We're exploring these medical conditions that present one way, but hide far more significant, maybe even dangerous truths right beneath the surface. Think of it as a kind of masterclass in medical disguise. We're drawing from some really insightful surgical perspectives on what we're calling horns and oddities.
It's definitely a fascinating corner of clinical observation.
So get ready, to have your understanding of superficial signs maybe challenged a bit.
Yeah, the sources we've looked at offer a pretty compelling view of these peculiar conditions, and they all have significant surgical implications, which is key here.
Right.
Our goal in this deep dive really is to distill the crucial insights, to help you understand not just what these oddities are, but the hidden dangers they might signal.
And the critical steps needed, I guess.
Absolutely. The critical diagnostic steps you need to take to uncover the real story. It's about recognizing when the body is sending you a subtle but potentially urgent warning.
Okay, let's unpack this then. A cutaneous horn. I mean, it sounds like something straight out of a medieval bestiary or, I don't know, a fantasy epic.
It does conjure a vivid image, doesn't it?
Definitely. So when you hear that term in a medical context, what precisely are we talking about?
Medically speaking, a cutaneous horn is quite specific. It's this conical, horn-like projection sticking out from the skin,
Okay.
and it's composed entirely of compact keratin. Now, here's an immediate point of clarity, something that often trips people up. It's sometimes called a sebaceous horn, which is misleading because, despite that name, it does not contain sebum.
No sebum. Okay, so it's not like a blocked gland or anything like that.
Not at all. It's simply a dense accumulation of keratin. Think of like an overgrown fingernail or maybe a rhino's horn in miniature,
Yeah.
but happening on human skin.
So if it's essentially just dense keratin buildup, like a really tough callus or, as you said, an exaggerated fingernail, what's the real concern? Where's the oddity or, the danger in something that seems relatively benign on the surface?
And that right there is the absolute crux of why this condition is such a vital lesson in clinical vigilance.
Okay.
The horn itself, it isn't the main problem. The real pathology, the actual danger, lies at the base of the horn, always at the base.
Ah, okay. So the horn is just like a signpost.
Exactly. It's a visible indicator, like a flag waving above an underlying lesion, and that lesion can vary dramatically in severity.
How so?
Well, the underlying lesion could be benign, something harmless like a common viral wart or a seborrheic keratosis.
Okay, relatively common things.
Right. But it could also be a pre-malignant lesion, meaning it has the potential to turn into cancer, like actinic keratosis, for example.
Which you often get from sun exposure, right?
Precisely. And that ties in because most critically, and this is where the real red flag goes up, it can be a manifestation of a full-blown malignant lesion, most commonly squamous cell carcinoma or SCC.
Wow. Okay. So it could be anything from a wart to actual skin cancer underneath.
That's the spectrum. And clinically, we often see these horns appearing on sun-exposed areas, the scalp, the face, back of the hands. That offers another clue.
This really drives home the importance of a thorough examination then, not just looking at the horn itself.
Absolutely. Looking beyond what just meets the eye.
So if I'm a clinician or even if someone listening notices this on themselves or a loved one, what's the absolute non-negotiable step? What must be done? Is there a common mistake here?
The non-negotiable step, and this is emphasized again and again in surgical literature, is to biopsy the base of the horn.
The base. Got it.
The horn itself is just inert keratin. It's dead tissue, essentially. It offers zero diagnostic information about the cause.
So just shaving it off isn't enough.
That's the common misstep, just shaving off the horn without examining the underlying tissue. It's pointless from a diagnostic view and potentially dangerous if you miss something serious.
Right.
The definitive diagnosis, benign, premalignant, malignant, absolutely hinges on the pathology found at its base.
And the treatment obviously follows from that.
Directly. A simple excision of the horn and its base might be fine for a benign lesion, but if it's SCC, you need a much wider local excision. Critical to ensure complete removal, prevent recurrence, prevent spread, you have to get to the root of the problem.
That's such a clear protocol. And our source material even had that great mnemonic for this. What was it? Horn points up.
danger lies beneath.
Yes, Horn points up, danger lies beneath. That really captures the core message perfectly, doesn't it? Makes it incredibly memorable.
It does. That concise phrase just distills the whole clinical imperative. It's a constant reminder. Outward signs can be deceptive, and the true threat often demands a deeper look, a precise investigation beneath the surface.
It's the essence of surgical wisdom, kind of boiled down.
In miniature, yes.
Okay, so from that keratinous Assad, hinting at hidden dangers, let's shift gears a bit. Let's talk about something with an even more historically striking name, Koch's peculiar tumor.
Ah, yes. That one definitely catches the attention.
It certainly does. What's the story behind this term? What does it signify today?
Well, Koch's peculiar tumor is indeed a historical surgical term. It's named after Edward Koch, the surgeon who first described it back in the 19th century.
Okay.
Clinically, it presents as an indurated, meaning hardened.
Hardened, right.
Yes, hardened, ulcerating, and often fungating, sort of mushroom-like growth.
Fungating, wow.
Yeah, and these are typically found in the groin or the perineum, and they usually arise from chronic inflammation or infection.
Okay, so right away the context is different. Groin, perineum, chronic inflammation.
Exactly. We're looking at a scenario where a long-standing unresolved issue in a, sensitive area can manifest in this deeply concerning way.
A chronic inflammatory process leading to that kind of peculiar tumor. It really suggests a long-term problem that's just been festering, hasn't it?
That's usually the case.
What kind of persistent underlying issues typically set the stage for something like this to develop?
Precisely. It's conditions involving prolonged inflammation, repeated infection, tissue damage over a long time.
Like what specifically?
Common causes include things like a chronic discharging sinus that's a persistent channel from an infection deep inside that continuously drains out to the skin.
Nasty.
Or tuberculous lymphadenitis, where TB infects the lymph nodes, particularly down in that region. Another common one is hidradenitis suppurativa.
Oh yeah, that chronic skin condition with the painful lumps.
Exactly, often in the groin or armpits. Leads to abscesses, scarring, chronic inflammation. Now here's the critical connection. Much like we saw with the cutaneous horn, these chronic conditions, if they're left unaddressed or just keep recurring, may undergo malignant transformation.
Ah, so there's that link again? Malignancy?
Yes. Often resembling squamous cell carcinoma, SCC. It's a slow, insidious progression from chronic irritation to a potentially very serious cancer.
That connection to malignancy seems to be a really vital theme here. Are there other medical parallels that help us understand the severity or maybe the microscopic appearance of Koch's peculiar tumor?
There's actually a very strong and instructive parallel. Microscopically, Koch's peculiar tumor closely resembles Marjolain's ulcer.
Marjolain's ulcer, I've heard of that. That's
Yeah.
cancer developing in stars, right?
Exactly. Marjolain's ulcer is a well-established thing in medicine. It's specifically an SCC that arises in chronic scars or wounds. Think old burn scars. Long-standing osteomyelitis tracks those bone infections with draining sinuses or indeed chronic ulcers.
So the clinical features fit perfectly.
They align perfectly. The indurated, fungating, ulcerating growth often linked to these chronic ulcers or sinuses. It's the same underlying principle. It really highlights how prolonged irritation and the body's repeated, perhaps flawed attempts at repair can sometimes go awry.
Leading to abnormal cell growth.
And eventually, malignancy. It's a stark reminder that chronic inflammation isn't just an inconvenience. It can genuinely be a precursor to something much more sinister.
So given this really profound connection between chronic issues and potential malignancy, what's the absolute unequivocal action? What should every clinician or even you, as an informed individual listening, demand if faced with something that might be Koch's peculiar tumor?
The vital surgical importance and really the overarching lesson here is this. Any chronic ulcer or sinus, particularly in the groin or perineum, that presents with induration, that hardness or any kind of new growth, it must be biopsied.
It must be biopsied. No waiting and seeing.
Absolutely not. This principle cannot be overstated. It just reinforces the broader medical understanding. Chronic, non-healing wounds inherently carry an increased risk of malignancy.
Why is that, fundamentally?
Well, when the body's repair mechanisms are constantly engaged over long periods because of that persistent irritation or infection, there's just an elevated chance for genetic errors to creep in during cell division that can lead to dysregulated cell growth and eventually cancer.
So it's a clear call for action. Investigate thoroughly. Don't just watch it.
Precisely. No complacent observation when you see those signs.
Okay, so bringing these two seemingly disparate oddities together, the cutaneous horn, this keratinous surprise, and the historical urgency of Koch's peculiar tumor.
Right.
What unifying insights emerge? What's the common thread tying these lessons together for you?
What's really fascinating, I think, is that consistent thread running through both. The critical importance of looking beyond the immediate surface.
Beyond the superficial.
Exactly. In both cases, the visible presentation, whether it's an inert keratin horn or a chronically ulcerated, hardened growth, is merely the initial clue. It's not the whole story.
And the key is,
The absolute necessity of getting a biopsy for a definitive diagnosis, especially with any unusual growths or these chronic non-healing lesions. That is the binding principle.
yeah,
These conditions serve as such powerful, almost textbook reminders of how superficial appearances can be profoundly misleading and the underlying pathology. That's the only true key to understanding, diagnosing, and importantly, effectively treating the condition.
it really is a testament to the fact that medical diagnosis often requires a literal deep dive, doesn't it? Right into the tissue itself.
It really does.
This really underscores how the body, even in its most unusual, maybe visually startling presentations, often provides these vital clues, if we just know how to interpret them. So what's the ultimate lesson for you, the listener, in recognizing these deeper truths? Maybe not just in medicine, but more broadly.
I think the biggest takeaway should be the immense value of vigilance, of critical observation, and understanding that chronic issues or any unexpected growths should always warrant professional investigation.
Don't ignore things.
Never dismiss something just because it looks like nothing or, because it's been there for a long time without seeming to change much. The consequences of overlooking an underlying malignancy can be severe, life-threatening even.
Yeah.
These peculiar conditions really underscore that sometimes the most unusual outward signs are actually profound warnings, urging us to dig deeper and question what truly lies beneath.
Wow. What a compelling deep dive.
Yeah.
Into conditions that genuinely make you think differently about what you see just on the surface.
They really do.
We've explored the deceptive keratinous nature of the cutaneous horn and that critical importance of investigating its base.
Danger lies beneath.
Exactly. And then uncovering the historical urgency behind Koch's peculiar tumor, a clear warning sign of potential malignancy lurking in chronic inflammation.
And through it all, I think the central message really crystallizes, doesn't it? The power of astute observation, combined with precise diagnostic steps like biopsy, it's paramount. These examples just highlight so well that critical understanding, appearances, can be profoundly deceiving, particularly in the nuanced, complex world of medicine.
Couldn't agree more. So maybe next time you encounter something that seems straightforward or perhaps even just an old curious term from the past, consider what surprising, maybe vital truths might lie hidden just beneath its surface.
Yeah.
What else in your world, might be more than meets the eye once you start looking closer and asking those deeper questions?